If you want to know if intensive care at home can look after a patient at home and has perforated small bowels and need TPN, stay tuned. I've got news for you. My name is Patrick Hutzel from intensivecareathome.com. And today I have an email from Sarah, who's a senior dietitian in Perth, Australia. And she says, "Hi, Patrick. I have a client who has a perforated small bowel and the stoma back in situ. Previously, due to stomach cancer, he had stomach surgery done to remove the tumor. Recently, he was called back by his hospital doctor to readdress, fix the perforated bowel, was on TPN while in hospital. I would also like to ask, is TPN at home possible? And if so, how about does he access TPN at home? He's on the home care package in Australia. I look forward to hearing from you," from Sarah. Sarah, thank you so much for reaching out, and home TPN for this patient is absolutely possible. Now, how does he access home TPN? The first thing this gentleman needs is IV access, and not any IV access. He needs either a central line, a PEEK line, a Hickman's line, or a porta cath. Either way, and all of those lines, to access any of those lines and manage any of those lines, it's a skill set of an intensive care nurse, right? That's the first thing that needs to be in place. Number two, how does he access TPN? He accesses TPN by, or through us, and we engage with the providers, TPN providers such as Baxter or Fresenius. I'm not making any commercials here for Baxter or Fresenius, but unfortunately at the moment they're the only two providers in Australia that can deliver on home TPN as far as I'm aware. Maybe there is someone else, but they are our go-to people, generally speaking. So then number three, he needs a team of critical care nurses that can manage the TPN at home, which also includes taking bloods and checking blood results regularly, check electrolytes, check sugars, check sodium levels and so forth, check hemoglobin, check white cell count. That's all part of the TPN course. Furthermore, it also the dressing of the central line, the PEEK line, the Hickman's line, or this porta cath also requires attention and needs to be done once a week under sterile conditions. And once again, our critical care nurses can do all of that. It's also important that if a client has a central line, a PEEK line, a Hickman's line, a porta cath, to flush those lines and aspirate blood, making sure those lines don't clot. Again, that is the skill of a critical care nurse here, so that the lines don't clot, because that could be a disaster. Then your client couldn't get TPN. But that is all part of our skill set, and that is all what we are taking care of at home for our home TPN clients. I hope that helps answering your question and hopefully gives you and your client some peace of mind here. So with all of that said, with intensive care at home, we are sending our critical care nurses into the home 24 hours a day. Therefore, we are providing a genuine alternative to a long-term stay in intensive care for ventilation, tracheostomy, home BiPAP, home CPAP, ventilation without tracheostomy, tracheostomy without ventilation, home TPN, home IV potassium infusions, and home IV magnesium infusions. We're also providing ventilation weaning at home. We're also providing central line management, PEEK line management, Hickman's line management, as well as porta cath management for home TPN, but also for IV infusions. We're also providing nasogastric tube management, PEG tube management at home, as well as palliative care services at home. We're also sending our critical care nurses into the home for emergency department bypass services. We have done so successfully as part of the Western Sydney Local Area Health District, their In Touch program, saving approximately $2,000 per patient that we keep at home instead of going to the emergency department. Therefore, we're also in a position to cut the cost of an intensive care bed by around 50%. An intensive care bed costs around $5,000 to $6,000 per bed day. Our service costs between $2,500 to $3,000 per bed day. And we are freeing up the most sought after bed in the hospital, which is the ICU bed. Most importantly, we're improving the quality of life for patients and their families, so it's a win-win situation for all stakeholders. With intensive care at home, we're currently operating all around Australia, in all major capital cities. in all major capital cities, as well as in all regional and rural areas where an NDI is approved service provider all around Australia, TAC and WorkSafe in Victoria, ICARE in New South Wales, NIISQ in Queensland, as well as the Department of Veteran Affairs all around Australia. Our clients and we as a provider have also received funding through public hospitals, private health funds, as well as departments of health. We are the only service provider in Australia that has achieved third-party accreditation for intensive care at home nursing in 2025. We have been achieving this level of accreditation since 2012. No other provider has achieved this high level of accreditation in the community and has created more intellectual property for intensive care at home nursing than we have. That puts us in a position to employ hundreds of years of critical care nursing experience combined in the community. No other service provider in 2025 employs a higher skill level in the community than we do, which enables us to look after the highest acuity adults and children in the community in Australia safely. And if you're at home already and you're watching this and you realize that you don't have the right level of support, I'll give you a very tangible example today. One of our first clients over 10 years ago was a client who was at home on a ventilator with a tracheostomy with the support worker model 24/7. Of course, support workers cannot look after a client at home on a ventilator with a tracheostomy. That is like flying the airplane with the cabin crew instead of the pilot, because on a ventilator, anyone on a ventilator with a tracheostomy is at very high risk of medical emergencies or dying if they don't have critical care nurses looking after them 24/7. And this is evidence-based and is documented in the mechanical home ventilation guidelines that you can find on our website. And think about it, in intensive care, in a hospital, you wouldn't have support workers to look after a critical care patient on a ventilator with a tracheostomy. So why would anyone in their right mind do that in a home care environment? So eventually this client found out about us. We were proving our concept with this client very quickly. When we worked with the client, we sent him intensive care nurses 24 hours a day. He never ever went back into ICU ever again. And we were proving our concept there very fast. We can do the same for you if you're not safe at home, which includes the advocacy for funding that goes along with it. We have always successfully advocated for our clients, otherwise we would not be in business. This is also why we are providing level 2 and level 3 NDI support coordination. We have a team of NDI support coordinators and they have a wealth of knowledge. I've done an interview with Amanda Riches, one of our NDI support coordinators, and we put a link to an interview with Amanda in the written version of this blog below the video. We're also providing TAC case management and WorkSafe case management in Victoria with Lucy McCotter. And if you're an NDI support coordinator or a case manager from another organization watching this, you're looking for nursing care for your participants, please reach out to us as well. If you're looking for funding for nursing care for your participants and you don't know how to go about it and what evidence to provide, I encourage you to reach out to us as well. We can help you with the right level of funding and with the right level of advocacy. We're also providing NDI specialist nursing assessments done by critical care nurses with a legal nurse consulting background. And if you are a critical care nurse and you're looking for a career change and you want to join a very progressive, dynamic, and high-performing team of critical care nurses in the community, we are employing hundreds of years of critical care nursing experience combined. If you're looking for a career change, we're currently hiring for jobs for critical care nurses in Melbourne, Sydney, Brisbane, in Albury, Wodonga, in Bendigo, in Geelong, and in Warragul, in Victoria. If you have worked in critical care nursing for a minimum of 2 years, pediatric ICU ED, and you have already completed a postgraduate critical care nursing qualification, we will be delighted to hear from you. I have a disclaimer, because we are offering a tailor-made solution for our clients, which includes regular staff. Our clients do want the same staff coming over and over again because they are so vulnerable and so special, and that's why we need regular staff. So if you are looking for agency work where you can come and go, this won't be the right fit for you. We are looking for consistency and our clients are looking for consistency. So please only apply with us if you can give us regular and consistent availability for shifts and you're really keen on building relationships with us and with our clients. And if you're an intensive care specialist or an ED specialist, we also want to hear from you. We're currently expanding our medical team as well. We can also help you eliminate your bed blocks in ICU and ED for your long-term patients or for your regularly readmitting patients with our critical care nursing team at home. We're here to help you take the pressure off your ICU and ED beds and in most cases, you won't even pay for it. Even if you do pay for it, it is much more cost effective than what you're paying for ICU and ED for. And you get the same level of care. And if you are a hospital executive watching this and you have bed blocks in your ICU, ED, respiratory wards, please reach out to us as well. We can help you there fast. If you're in the US or in the UK and you're watching this and you need help, we want to hear from you as well. We can help you there privately with one-on-one consulting and hiring nurses privately. Once again, our website is intensivecareathome.com. Call us on one of the numbers on the top of our website or simply send us an email to info@intensivecareathome.com. And if you like my videos, subscribe to my YouTube channel for regular updates for families with intensive care at home and intensive care. Click the like button, click the notification bell, share this video with your friends and families, and comment below what you think about this video and what you want to see next. Thank you so much for watching. This is Patrick Hutzel from intensivecareathome.com, and I will talk to you in a few days. Take care for now.